Is your job making you sick or even killing you? The National Institute for Occupational Health is carrying out a surveillance project. It wants to check if there is an increase in deaths from diseases within specific occupation groups. It says it's crucial to identify and prevent occupation-related morbidity and mortality. Vusi Ndlebi from the Institute joins me now. Very good morning to you.
Good morning.
What have you found?
Well, a number of things interesting, but I must say that because it's only at the beginning of the project, most results or so to speak, decisions, or as you ask, what have we found, it will only be clearer as we go along with the project. As you say, it's a surveillance.
Okay, so what are you looking at?
We're looking at death by occupation. So what we're looking at exactly is that what occupations are suffering from or dying from, and from which disease. And then we found that, as an example, that professionals, for instance, and managers are suffering from the non-communicable diseases, CO diabetes, CO hypertension, which makes sense in the sense that they are mostly, sitting behind the desk in front of the computer, and if you don't look after your health, then it becomes a problem, the disease itself.
And deaths? What industry is more susceptible to that? Actually,
the surveillance is about deaths. I'm just saying that before you die, obviously you'll be suffering from the disease. But yeah, the deaths are what I've just told you, that the armed forces, for instance, we found that HIV and AIDS is at its highest. TB, for instance, we found that the elementary workers, your gardeners, the odd job people are suffering a lot from TB.
How do you conduct this sort of research? Where do you start, and who are you bringing into that?
That's a good question. Remember, this is a secondary data surveillance where we source our data from Stats SA. It provides us with all the deaths in the country, and then we go on further and sift through that data and take out the deaths of by occupation, and therefore find the PMRs, which are the proportional mortality ratios.
How are we doing in the media?
Beg your pardon?
How are we doing in the media?
As you're sitting there, you might be sitting on a non-communicable disease.
Oh,
you must start exercising.
I do.
Okay, that's good for you.
We'll talk about this later. Okay, so what do you plan to do with this sort of information?
True. Yeah.
How does it get out there to those who need to know it?
Yes. The first contact is our website, where you can go into www.nioh.ac.za. Remember, we are also a child or a subsidiary of the National Health Laboratory Service. So if you also go into that, you'll find us there. But also, we're planning to, as I said, this is a surveillance going forward, because we need to see, to find out why are these people dying from these diseases. So we might, in the future, send our people to go and do surveys and research to pin it down to something. Why are these people...
No, I think it's great. I think it's an important thing to be doing, and I should imagine that insurance companies would be interested as well to find out and adapt their policy accordingly.
Of course.
And then if you know that you are susceptible to any of these, there is what is it that you suggest you do other than exercise?
Look, before we go to that, I would like to say you've just raised an important point about policy. Our aim is to redirect policy and get the powers that be start talking about the important questions. But yes, that's one of the intended use of it to influence policy.
All right. Thank you for talking to us.
Thank you for inviting
us. About that, Vusi Ndlebi. Thank you.
You're welcome.